Okay, well, I think this is working, and this is my first live stream. My name is Doug Weiss. I've been a physical therapist for 30 years, and I've been doing a YouTube channel for the last two that talks a lot about balance, fall prevention, and how anyone can both improve their balance, reduce their chance of falls, and get a little bit stronger, which is something I think all of us want. Um, when I first started doing this channel, I actually started it to advertise a course that I was teaching for physical therapists, and I had made an ad on YouTube for the course, and started noticing that I'm getting a lot of views for the ad, and I kind of paid attention to it for a little bit, and then sort of ignored it. And then one day I came back and I saw that a couple 100,000 people had seen this video. And my first thought was, oh no, I've targeted the wrong people, because mainly it was seniors and people with balance problems that were responding to that video. And my intention was to reach physical therapists. Well, one thing led to another, and I realized that there was probably a bigger need to talk directly to the public about these issues. So I started the channel, and I've been doing this for a couple of years now of posting, 3 or 4 videos a week that deal with topics such as balance, fall prevention, strengthening, flexibility, all with the idea that the channel would help people, older people, not only prevent falls, but regain their balance, because that was the majority of what I did in my practice. And so I decided to try to create a channel that would help people that same way. So this is my first live stream. I was encouraged by YouTube to try to do this. I think I've started a little bit early. So in case you're just joining this, feel free to ask any questions through the chat question box. And I was planning to just answer some of the more common questions I get asked about balance and fall prevention, and how older people particularly can improve their balance. But really, the channel is not just for seniors. The channel is for anyone that has any type of issue that's causing them to fall. A lot of my patients in my clinic have head injuries, and so some of those are high school students and even teenagers. A lot of my clients are younger people that have had serious accidents, that have had strokes. And with COVID, a lot of people now have had strokes that never had before. So I'm actually seeing a lot more younger people too that come to me with balance problems. I pretty much, on any given week, about 10 or 15% of my clients are people that are well under the age of 30, that have a balance problem, or they're having some kind of problem with their walking. So let me start answering just some of the more common questions that I get. Probably the most common one I get from my older clients, and they just tell me, basically, once I've lost my balance, can I even get my balance back again? And I always laugh at that, but I realize that it's not just the patients. There's a lot of doctors, there's a lot of healthcare professionals that kind of have the mindset that once you start falling, that's it, that you're going to continue to fall, and that it's only going to get worse, and it's something that you really can't recover once lost. And I kind of feel like I've dedicated almost my entire career to learning about how to reverse balance loss. A lot of people, they've had a neurologic injury like a stroke or a concussion. They might be getting dizzy all the time for different reasons. But more than likely, most of the patients, they're really just falling, and they don't know why. And I'm here to tell you that once you begin to fall, once you start having falls, doing things like balance challenging activities or fall prevention activities really can reverse that problem. And I think that most people have been able to recover their balance once they're given sort of the right treatment plan, which is not usually strengthening, but it's usually more balance challenging activities. So another question that I get asked a lot, oh, I see someone did send me a chat, Cher. So hello, Cher. Thank you. I do get a lot of messages from people that are fitness instructors or work with the elderly. So I appreciate all of you. And I certainly hope that anything I'm doing is helpful to you. But a lot of questions I get are, basically, what's the best way to improve balance? And first and foremost, the thing that I hear most often is strength. People assume, I notice it all the time on my channel, that I'll post a video about balance, things that'll improve balance. And usually it's more balance challenging activities. And a lot of people will post something to the effect of, well, the people are falling because they're not strong, or because they're losing their strength, they're falling, or more commonly, when they lose their core strength, they're falling. So I agree with you, in that thinking. I know when I went to PT school, that was often mentioned, that, that older people, the people that are experiencing falls, a lot of times it's because they're not strong. And I was surprised when I finally started doing some research to learn that that really wasn't the case. And I think I should try to explain that a little bit. In study after study, where they give seniors that are falling all sorts of strength exercises, whether it's Pilates or CrossFit or weightlifting or powerlifting, I mean, you name it. There's been a research article that looked at different types of interventions that were strength interventions to try to help people reduce their chance of falling. And time after time after time, it doesn't reduce the chance of falling. And that's always surprising to the researchers. It's surprising to a lot of doctors. Why doesn't strengthening itself improve, falls or reduce falls? And the answer, as it turns out, is sort of, we're probably not asking the right question, is the reason why that answer comes about. First, you really should ask is, why are people falling? And they're not falling because they're weak. And that's been shown in a lot of research, that it doesn't matter how old someone is or how strong they are, people can fall at any age. And by far, the main reason that people are falling is because when something causes them to stumble or causes them to lose their balance, they don't have the ability, the skill, or even maybe some people might call it the programming to counteract that. Like, say you're walking along and a kid bumps into you. Some of us, if our balance is really good, it's not a big deal. The kid bumps into you, you're not going to fall down. You kind of shuffle around a little bit, regain your balance, and go on. But for some people, when they lose their balance, when something bumps into them, they just don't have the programming to counteract that. And it's not just strength. It's not just a fact that they're not strong enough. Even though they might be very weak, you don't need that much strength to maintain your balance. And that's what always surprised me, is that when you look at people's strength, older people, a lot of older people don't have a lot of strength because they haven't been exercising. They have a lot of atrophy. They might be in their 90s. They're just, muscles aren't as strong as someone that's in their 30s. But what's funny is, you really don't need that much strength to maintain your balance, to be walking upright, to get through your day. It's actually very little strength is required. So even making someone that's very weak a lot stronger, you don't see a big improvement in their balance. But instead, if you take someone that's falling, that's having balance problems, and you do things like Tai Chi or yoga or dancing or just straight balance challenging activities, you see this incredible improvement in their falls. You see a reduction in their falls, an improvement in their walking. And those people are more able to resist falls going forward because they're doing things that challenge their balance. And that's basically the entire YouTube channel that I have, is to kind of push this idea that balance challenging activities really are the best way to not only regain your balance, but maintain it and prevent falls in the future. Okay, I'm gonna take a few questions. Donna wrote that she has some lumbar stenosis and trouble standing for a time without holding on. And that's a pretty common problem. And lumbar stenosis causes people to have weakness, which is kind of the opposite of what I just said. But if you have a severe amount of weakness where you can't even maintain your body weight when you're standing, that's a problem. And the good thing is with things like lumbar stenosis, you can do strengthening exercises that really reverse that. I know a couple days ago, I posted a video that was the 10 best strength exercises for seniors. And if someone has lumbar stenosis, I would recommend all 10 of those exercises. You know, standing exercises against gravity are one of the best ways to improve strength when you have something like that. And you can actually reverse that problem, because even though you have lumbar stenosis and that signal's not getting to your muscles as well, doing strength exercises can counteract that because it can make you stronger. The same as someone who has polio or had polio. The polio itself, it weakens you because it damages the way the nerves work, so that you don't get the signal going to your muscle and you become paralyzed. But what they found is that if you did exercise on those muscles, if they were just had a little bit of strength in the beginning, you could strengthen them enough that it almost looked like the polio went away. It didn't go away, but you are counteracting the effects of the polio by making yourself stronger. And the same is true for someone with spinal stenosis. You can strengthen yourself so that that problem really isn't as big of a problem for you anymore. As long as you maintain that strength, you're pretty much, getting rid of that problem. Okay, another question is from Laura Brinker. And she said, I have cerebellar ataxia. I'm using a walker. I'm catching myself almost falling backwards. Should I eat first before exercising? I'm not eating enough. Yeah, I don't know if I can talk about, I'm not a dietitian, and I don't really know much about, diet with cerebellar ataxia, but I do know a lot about cerebellar ataxia. It's a common problem. There's a lot of different diseases that cause that. Parkinson's can cause that. Strokes can cause it. But there are a lot of autoimmune diseases and diseases that just affect the cerebellum that can cause cerebellar ataxia. And it is a very serious problem. And physical therapy can help that. I do specialize in that, and I work with a lot of people with that. I can tell you that target training, in other words, doing things like walking heel to toe on a line or tapping something, those are really good exercises to help reduce the effects of the cerebellar ataxia. And people with that can improve their balance and they can see gains in their walking. But it's something that you really have to work specifically on those type of exercises. My channel is full of exercises like that, and a lot of the balance challenge activities would greatly benefit someone with cerebellar ataxia. Okay, let me look at some of the other questions, and it's one from Lars Ekman. Do you use exercises to stimulate the vestibular system, such as head turning? So I do in my practice. I see a lot of people with different vestibular problems and balance problems, and there are some head turning exercises that I use. The only one that I've done on YouTube is one that I call PVT exercise. There's been a few videos that I've posted about this, and it's an exercise where you stand heel to toe with a chair or something nearby just in case you need to grab it, and you practice shifting your focus of your vision from down to center to up, and you just keep doing that over and over. And anytime you lose your balance, you keep looking in that direction until your balance comes back, and that actually is a very effective way of improving your vestibular balance. Let's see, I see someone just deleted a message. Not sure what that was. Ew. Oh, I see, people communicating. I have to apologize. This is the first time I'm doing the live streaming thing, and I see 66 people or so are showing up. That's amazing to me. I'm actually amazed that anyone's paid attention to me on YouTube at all. So I appreciate all of the comments. I appreciate whoever is watching this. Really, I'm here just to try to help people. I've been doing this a long time, and all I really want to do is reach as many people as possible with the message that if you've lost your balance or you're having trouble with your balance, it's something that's a skill, and that you can definitely improve it with the right type of training. So Thank you for everyone that's watching me, and I see the thank yous. That's really nice. So someone else asked a question about pinched nerve in their lower back and lots of numbness. Yeah. So there are exercises that I've done on my channel that help, supposedly pinch nerves. The thing is, it's really hard to do something like that through YouTube. It's hard to diagnose yourself, and it's hard for, as a physical therapist, you really want to put your hands on someone to treat something like back pain or weakness due to some kind of orthopedic problem. There's no real way that you can present exercises or treatments through this type of medium that would help someone with those types of problems. I would say that if you have a pinched nerve, I've shown some I think good exercises. One of the best and the safest is a plank. And I've shown a couple different versions of plank on my channel. I think I did a video recently that said the single best exercise to get rid of back pain for seniors. And that's something called a chair plank, where you're doing a plank, but you're doing it on a chair, because a lot of seniors can't get on the ground to do a plank. So you do it on the arms of a chair, and it works just as well. And what that is it's called a spine neutral exercise. So it's an exercise where you're not extending your back or flexing your back, but you are activating all your core muscles, and then you're holding it statically for a few minutes. And it turns out that's actually the best way for anybody to improve their strength in their back. And if you have a problem like spinal stenosis, it actually can make it better. It can improve it. So especially for seniors, I think that's a great way to go. And that's why I've shown that exercise a few times. Okay. A lot of thank yous. Thank you, Brenda, Maria, Linda, and Denise. I definitely am happy to answer any other questions. Recently, I started doing exercise videos, which is something, when I started doing this, I kind of thought I wasn't able to do that because I didn't really have a concept of how to make an exercise video that would help someone with a balance problem. And at the same time, I realized and recognize there's things like Tai Chi and Qigong and Pilates. There's a lot of good techniques out there, exercise formats out there, like yoga, that have been around for centuries, that really do help people with balance. And I didn't really know how to improve upon that. But I've realized recently that where I can help is with something I call neuroelastic exercises, which are, I've been posting them recently, which are the 15-minute and 30-minute exercise classes that I've been posting. And those classes are really aimed at people whose balance is so bad that they can't really try Tai Chi or yoga. They're really at risk for falling. So those classes, that what I call neuroelastic training, those are really aimed at the people that watch my videos that are really struggling with their balance. A lot of them, they might really be mainly in a chair all day long and walking very little. And if that describes you, then those exercises are really for you. My 15-minute, my 30-minute exercise classes that I've been posting are perfect for someone that's at that level. So I appreciate all the kind words. I'm seeing more people posting. I'm going to do this probably for about another 10 minutes or so. Forgive me. This is really my first time doing it, and I wanted to figure out how to do this correctly. It's a little bit of skill on my part that I'm having to learn how to use the camera and the live streaming software that YouTube has. But if you have questions, I'm going to be doing these live streams probably weekly. And if you have questions, or if you want to ask me something more specific, this is probably the better format to do it in, through that chat window. You can always leave messages for me in my videos, and I really do try to read them all and go through them, and try to answer anything that I can. But when things get really specific, I get uncomfortable just because I'm not able to treat people out of the state of Hawaii where I live. And so if it gets really specific, I get a little worried that it would be considered physical therapy, outside of the state lines, which is a no-no. So If you can ask me general questions about things, that's usually the best, and I can kind of answer not for one individual, but for anyone with a certain problem. But thank you, for all of the support and all the people that are here right now watching this. I'm trying to think of some of the other questions I get commonly asked. Let's see. So we've talked a little bit about strength, and what I really didn't go into was balance challenge and how that has helped people. And I really learned about all this stuff kind of in a funny way, where I in physical therapy school, I really learned that strengthening and then static balance activities like standing on one leg or standing on a cushion, that was pretty much the most that I could do. I graduated physical therapy school in the early 90s, in 1992, and really that's what they taught us. And I was kind of surprised to learn that even 10 years ago, that's still what they're teaching for physical therapists. The programs don't really go into improving balance. They're really much more about orthopedic injuries and the science behind physical therapy. But as far as treatment, a lot of them really don't go into stroke rehab or head injury rehab. That's considered a real specialty, and you don't see physical therapy schools really talking about that. But what's interesting is about 10 years ago or 15 years ago, there was just this huge amount of research on this topic. And they were talking about things like, why does Tai Chi and Qigong and yoga seem to be more effective at fall prevention than physical therapy? And I think the reason is because physical therapists were really doing the wrong thing. They were really focusing on strength training. And as I've explained, that just doesn't seem to improve balance at all. And so, you get an hour session with a physical therapist. If they're spending 20 minutes or 30 minutes on strengthening, I'm not going to say they're wasting your time, but that's been shown in study after study not to improve balance. So what I learned was it was the activities, the balance activities, that really were the most effective thing. So having a patient step over, a step, or step over an obstacle, or walk heel to toe on a tape line, or walk up and down stairs backwards, or step on something very soft or on the grass, that's actually more effective at improving balance than having them lift weights or having them go work on exercise machines. In fact, hands down, using machines or weightlifting really doesn't improve balance. And doing things that are highly balance challenging does. There's what's interesting in the research is that the more the challenge, the more the improvement in balance. And I think that's really important to think about. That balance challenge really is the best way to improve your balance and reduce falls. And if you think about it, it makes sense because children that learn to walk, I have young children. When they first learn to walk, when they first learn to stand, I'm not strengthening their legs. They're not standing because they're exercising. They're standing because they keep trying to stand and they fall down, and eventually they stand. And it's like innately we know that a child needs progressive challenge, and they do it on their own. They want to walk, so because of their desire to walk, they stand, they take a step, they start to walk backwards, they walk sideways, they run, they do all these different things progressively, and every one of them, because they've never done it before, is a challenge. And so that's the way a human is almost programmed to improve, is through challenge. And that's why I believe the best therapy for someone that's having any kind of balance problem, any kind of walking problem, is not strengthening, but challenge. So let me take a look and see if there's any more questions. Wow, thank you all for all these nice comments and everything. I appreciate it. I really do. Let's see. Bella or Bala, you said that you have Parkinson's disease and spinal stenosis, and I want everyone to know. So Parkinson's, is a difficult disease. I treat it a lot. There's, it manifests differently in different people. Some doctors even believe there's more than one type of Parkinson's. I'm not really sure about that. I think it's like a lot of things. There's a spectrum. Some people have a form of Parkinson's that develops very slowly, and it causes movement problems. Parkinson's kind of has two main effects. One is it affects the cerebellum. So a lot of your coordination and also awareness of where you are in space comes from the cerebellum. So if you have damage to that area, you don't really know exactly where your arms and legs are. You don't know where your body is in space, as well as someone who doesn't have that. And then it also affects a type of tissue in your brain that produces a neurotransmitter called dopamine. And so because there's less of that neurotransmitter, your movement is slower, your thinking is slower. It actually affects a lot of things. But one thing I do know is that certain types of physical therapy or exercise really can help it. Strength training, not so much. It's great because if you have atrophy, it can help reverse the atrophy. But if you have Parkinson's and you want to improve your balance, then doing things like walking backwards, walking sideways, stepping over objects, practicing turning, those really help. In fact, one of the best things for Parkinson's, and I do this in my clinic, is with an overhead harness on the patient, have them on the treadmill, and I stop and start the treadmill. And whenever I start it, they don't know that I'm going to start it. And so it kind of feels like the ground is coming up below them, and they take a protective step. And repeatedly taking a protective step forward, sideways, and backwards really has an amazing effect on people with Parkinson's. And it really reduces falls. In fact, one session of that, I have a study that says one hour session of doing that with a Parkinson's patient can reduce falls for 6 months. That's amazing if you think about it, that just practicing sort of resisting falls for 1 hour, for 6 months, you'll fall less. So to me, that's a big reason that people with Parkinson's should get this type of training. And if you can't find it on your own, my channel definitely shows those types of exercises. But if you can be with a physical therapist, I think that's the way to go, to have someone helping you. Okay, Jerry asked, do your videos address nerve issues when visual, joint, vestibular are all involved due to HSP? And I have to admit, I don't know all these acronyms that people say. I don't know what HSP is. But to answer that question, the type of training that I'm showing, the type of videos and the type of exercises that I'm really pushing, they will help anyone that has any type of neurological problem, whether it's damage from a stroke, multiple sclerosis, Parkinson's, head injury, concussions, post-concussion syndrome, anything that denies your brain awareness of where you are in space, or the ability to properly coordinate movement, can be helped the most by balance challenging activities. So I hope that answers that question, Jerry. But if you can, please tell me what HSP is. I'm wondering if you're talking about a type of Parkinson's, but I'm just not sure. Forgive me, I just don't know what HSP is. But someone above said something about being 59. Said, I had surgery gone bad. I'm only 59 years old. Brenda. I'm sorry, Brenda. You and I are virtually the same age. And, it's hard. The younger you are, the harder it is to kind of give up your mobility. It's not because it's any easier when you're 80 to give up your mobility. But I think the difference is, you can kind of tell yourself, well, I've had a lot of good years of being independent. But when you're 35 or 45 or 55 and you lose your independence, you don't expect that. It does happen. And, my job has always put me in contact with people that are kind of like the worst case scenario, people that, have horrible brain injuries, and a lot of them are very young. So I'm sorry that you're like that. Honestly, most people, if they do the types of exercises that I'm showing, particularly these little exercise classes that I'm now doing, it really can help. And I've seen people just completely turn around their disability. It may not be that anyone can fully become the way they were before the injury, but a lot of people can get back their balance, their independence, their ability to function again. And that's the thing about life, is that when you can't be independent, it is hard, and it really takes away something. And a lot of people, they just don't do well without that feeling of, I can go to the bathroom on my own, or I can cook my own meals, or I can go to the grocery store. And so if I can help someone, go back to doing those things, I feel like I've accomplished something. But a lot of times, I can't get someone back the way they were before their injury, no matter what I do, but I can give them back their independence. And, for different people, that means different things. So, let me try to think of some other, common questions that I'm asked. Let's see. So a lot of people ask me about neuropathy and how neuropathy affects their. Oh, Brenda. Oh, hold on a second. Oh, Brenda, I'm not giving up. Oh, thank you. I'm really glad, Brenda. I honestly hope it's helping you. And if you ever want to ask me questions on any of the videos, please just, post your questions there specifically. But I'm glad that anything I'm doing is helping someone. I think that's the cool part about YouTube, is that I'm getting emails from people in Sri Lanka and, African nations that are telling me they're watching my videos after a stroke and it's helping them. So that's really something, and I'm certainly willing to keep doing this just to get that kind of response. So I'm glad that it's helping you, Brenda. But getting back to neuropathy, and this is probably my last topic, and then I'll sign off. A lot of people have neuropathy. So if you don't know what that means, it means that you're usually it's in your feet, that the sensation in your feet is impaired. It can be impaired because of diabetes, nerve disease, blood vessel problems. Yeah, diabetic neuropathy. And so what happens is you don't have sensation in the bottoms of your feet. And you would think, why would that affect your walking? Well, turns out our brain needs that input from the pressure of the ground to help us coordinate our movement. So in our minds, we have a program for how to walk. And that program is partially dependent on sensation in your feet. So if you lose the sensation, it's almost like losing your sight. You can still walk if you're blind, but you've got to learn how to do that again. And the same is true for someone with neuropathy. So I'm here to tell you, if you have neuropathy, the best thing you can do is balance challenging activities like the ones on my channel, because that will help you relearn all those programs. And actually, your brain will learn to walk and balance without that sensation. And that can be done. I remember, I don't know, it comes to mind a story. I had a patient in the office I'm actually in right now. I have 3 little offices here in Hawaii. This one's in Hawaii Kai. And I had a patient here. He was a college professor, and he had terrible neuropathy because of chemotherapy. He had prostate cancer. And, sometimes when you get chemo, one of the side effects is neuropathy in your feet. It just kills your nerves. And so he couldn't feel his feet, and he was falling all the time on campus. And he felt like his life was over. It was kind of sad. And he was such a nice guy. He was a physics professor and such a nice guy. And I really wanted to help him. And I basically said, any exercise, any balance exercise that I give you is going to help you, because you're going to then relearn how to balance with that challenge without your sensation. And he says, what do you mean? I said, well, right now, all your programs depend on your body knowing where your feet are because of that sensation. So if you practice balance challenging activities for a few weeks or a few months, your brain will relearn all those programs, but without the input from your feet. And it worked. And I knew it would work because I've done it before, but it's worked with lots of patients. But many people don't realize that if they lose their sensation, that stopping doing any activity actually just makes it worse, because then your programs get worse and worse and you can't balance. But if instead you safely challenge yourself and walk on uneven surfaces and do balance challenging exercises like the ones I show, you actually can not only improve your balance, but make your balance exist without that input from your feet. And it can be done just the same as someone can lose their vision and learn to walk perfectly well. Let's see. Someone else said the same thing. I have peripheral neuropathy. I'm 50. I'm sorry. That's actually pretty common. And a lot of people in their 40s and 50s, it can get really bad. Yeah, and you're exactly right that with balance exercise, it can get 100% better. Well, I've kind of reached the end of my time. I did start this early. I don't even know if this can be replayed or not. But I am gonna need to end the stream soon. Oh wait, someone just let me read what this person said. Oh, Pamela said, my parents lost their independence and home because they lost their strength, balance, and walking. Yeah, that's very true, Pamela. And honestly, I'll say this kind of ending here. The thing about balance and the thing about falling and independence is this. If you look at in the United States, the money that's spent on all healthcare, all injuries, cancer, heart problems, everything, the number one expenditure is on falls. And people don't talk about it because everyone just assumes there's nothing that you can really do about it. But all of the healthcare dollars, it's almost 60% of United States healthcare dollars are spent on falls or injuries related to falls. And the reason is not only do people go on the ambulance to the hospital, see their doctor, but they go in nursing homes, they go in elderly care centers. They end up requiring a tremendous amount of help because of a fall. And really, you can't stop all falls, but you can certainly reduce the risk of falling. And of all the things I've read that reduce the risk of falling, balance challenging activities is number one. And so, if anything, my channel is dedicated to preventing falls. And I want to think that I'm reaching people and helping people with fall prevention, anywhere that they can use YouTube. So again, thank you very much. I'm really enjoyed this. I'll definitely do this again. I'm going to aim for next week. Obviously, I've got to schedule it, and I hope this video quality even gets better than this one. But thank you so much, and I'll look forward to hearing your comments in the future.